The external features of skull is studied under different aspects. Study of skull from superior aspect is called Norma verticalis. From inferior aspect is called Norma basilis. From anterior aspect is Norma frontalis. From posterior aspect is called Norma occipitalis. From lateral aspect is called Norma lateralis. In this video, let's discuss about Norma verticalis. On seeing the skull from top, that view is termed as normal verticalis. The shape of skull, from superior aspect, appears to be oval-shaped, approximately. And posteriorly, it is wider. The bones seen from superior aspect are frontal bone, in the front, parietal bone on each side. Posteriorly, is the occipital bone. The sutures, seen in Norma verticalis are the coronal suture, the sagittal suture, lambdoid suture, and metopic suture. The suture present between the frontal bone and two parietal bones is the coronal suture. The suture present between the two parietal bones is the sagittal suture. The suture present between the two parietal bones and occipital bone is lambdoid suture. It resembles the symbol lambda. Hence the name. Next, we have the metopic suture, which is present in the median plane. It separates the frontal bone. It is usually seen in fetal skull and fuses at the age of 6 years. Let's see the important landmarks, seen in superior aspect of skull. The highest point, on the sagittal suture is known as the vertex. It lies on sagittal suture. The meeting point of coronal suture and sagittal suture is called bregma. In the fetal skull, at the site of bregma, there is a membrane gap called anterior fontanelle, which fuses when the baby is 18 to 24 months of age. The meeting point, between the sagittal suture and lambdoid suture, is the lambda. In the fetal skull, at the site of lambda, there is a membranous gap called posterior fontanelle, which fuses when the baby is 2 to 3 months of age. On either side of sagittal suture are the parietal foramen. In between the parietal foramen, on the sagittal suture, is the oblion. The area of maximum convexity of parietal bone is called the parietal tuber or parietal eminence. Thanks for watching. Like, share and subscribe our channel for more videos.